Hi everyone, my name is Victoria. I'm the co-founder and CEO of Health and Help. In Health and Help, we believe that no one should suffer or die from curable diseases. That's why we build clinics for the people who live in very complicated conditions and provide basic medical assistance for them. Since 2015, we built and operate 2 clinics, one in Guatemala and one in Nicaragua. All this is only possible because of the volunteers that help us to run our mission. We believe that we become a better people by helping others, but also our volunteers do so many things. They gain professional skills, they learn new languages, they travel new countries, and also they are so blessed to work with our great team.
If you are a seasoned medical professional just starting out your career or from a completely different field, there are opportunities for you.
Keep watching. We will have a virtual tour for the clinics. You will learn everything about our organization and see if it fits you or not. People in our villages in Nicaragua and in Guatemala live very simple lives. Sometimes they don't know how to write or read. Sometimes they don't know the date of their birth. And sometimes they describe their symptoms in a very interesting way. But they respect doctors so much, and even if you're a medical student or a nurse, they might call you a doctor. In our villages, it's pretty safe, but when you travel from Guatemala City or Managua, it's always better you take Uber or taxi. Also, before getting in a taxi, please make sure that you and a driver have a convenient price, otherwise they will overcharge you. There are not rules about how you should wear and what you should wear, but we prefer you to wear modest, no tight skirts, shirts, and expensive things like expensive jewelry. Also, inside the community, please be respectful for the people that we work with, because you are the face of organization, you are the face of the clinic, and you are the person that these patients will finally trust. At Health and Help, we pride ourselves of inclusive and welcoming community for the volunteers from all around the globe. We believe that your expertise, background, and experience will benefit our organization, though there are some strict guidelines that we ask to follow all our volunteers. Health and Help is smoke-free, drug-free, and alcohol-free for all the volunteers and staff.
We believe everyone should be treated equally, no matter their race, sex, gender identity, sexual orientation, nationality, native language, religion, age, disability, marital status, citizenship, genetic information, pregnancy, or any other protected characteristics.
We believe that by open communication with each other, our volunteers can create a supportive environment for all of them. We take our guidelines pretty serious. For any of the volunteers who will continuously disrespect our guidelines, we will ask to leave our organization. Health and Help clinics operate as a basic medical health centers. That means that we see patients with basic medical problems. We can do basic surgeries with the local anesthesia. We provide medication for certain conditions, we treat chronic and acute patients, and we refer people to the hospitals. We also run several important programs, such as diabetes program, hypertension program, epilepsy program, healthy mother, healthy baby program, and also help with birth control for young women and young mothers. In our clinics, we also perform basic lab tests, ultrasound, and ECG. At the clinic, we also have our own pharmacy, and some medication are very familiar to you, but some might be new. We will have a list for you to see what medication we use in our clinics. We encourage our volunteers to make a volunteer fundraising before they come to the clinics. All money that you will collect will go towards medicine, helping the patients, medical assistance that we provide in the clinic. You can do this fundraising through your social media or through the special fundraising platforms. Also, if your job wants to help you with fundraise some money, family or friends, you are welcome to tell them more about the important mission that you are doing together with us. Supervision is needed for each medical student. It means that you will have an experienced mentor together with you, helping you to gain new medical skills.
For short-term volunteers, there is also a volunteer contribution that covers the costs of your stay, as well as supporting our daily operations.
In your instruction for traveling, we will also include how to buy a SIM card, how to get to the clinic, what things you need to bring in these countries. So stay tuned.
In Health and Help, we want volunteering to be an accessible option for everyone, regardless of your financial situation. We provide you with comfortable accommodation, free vegetarian meals a day, and some comfortable company.
But there are some things that you will be need to pay yourself. This includes airfare and transportation, including the tickets from your country to Guatemala or Nicaragua, where we have our clinics, and transportation to the clinic from the airport.
Health and Help does not provide transportation from the airport to the clinic, but our team will assist you in planning your travels so that you can travel affordably and safely.
We also ask you to bring cash money for your personal necessities, better in a small bills, not $100, and you can exchange that for the local currency.
Remember that the credit cards are not accepted in all places, specifically in Guatemala and Nicaragua, so it's better to bring some cash too. Also, you are responsible for all the fees associated with your passport and documentation needed to travel. If you need help purchasing your tickets or any help with your paperwork, please contact our volunteer coordinators. Their contact information is below.
You can check the traveling list with the items you might need, depends on the season you're traveling in. Is it winter or summer or rainy season? You might need a very different types of clothes and personal belongings.
Please take time to prepare and plan your trip adequately. We are here to help.
At our organization, official language we talk to each other is Spanish. So if your Spanish level will not be satisfying, we will help you to prepare to get you to the level you need for your position. Communication is a main skill that we want to see in our volunteers. Some of our patients see doctor for the first time, and you will be the first person they talking to. Be kind. Guatemala and Nicaragua are the countries with the most beautiful cultural heritage. In Guatemala, the culture is a mix of indigenous Mayan heritage and a colonial Spanish influences. People speak 22 native languages. In our village, people speak Quiche, a part of Spanish. That culture is very deep-rooted in food, the traditional clothing, and even in the things that you can buy in a local market. The view from Guatemalan clinic is breathtaking. You can do yoga, go jogging, or simply walk around the village. The only rule that one doctor always has to be at the clinic. There are a lot of activities you can go to do around the clinic. For example, climb volcanoes or do surfing. There are also several historical cities about 2, 3, 4 hours away, so you can go on the weekend and have a very nice historical vacation. In Nicaragua, the culture is a mix of Spanish influences and Afro-Caribbean elements. This all reflects in the food, festivals, dances, and even songs. Our Nicaraguan clinic is located at the Pacific Ocean. It's very beautiful. You can go swim in the morning and after work right in the ocean. It's about 50 meters from the clinic. Sadly, because clinic located in a jungle, there are a lot of insects, including mosquitoes. So we will be kindly ask you to use repellent and sleep under mosquito nets that we provide. Clinic is the only facility in the village that has electricity. We get it from the sun, we have solar panels, solar batteries, and even our pump is working from the solar energy. Our clinic in Nicaragua is a form of the cross. We have several consultation rooms, a pharmacy, a living room for the volunteers, 2 dormitories, and a great garden. The school in Nicaragua is much poorer. It doesn't have walls, for instance, and the teacher comes for a week from the faraway town. There are a lot of activities you can do when you are not at the clinics. In about 2-3 hours you can go surfing or climb volcanoes. As well, there are a lot of historical, beautiful cities in Nicaragua. About 5 hours away is Chinandega, and close to it is Leon. Has a lot of interesting things and also hipster cafes. You also can take bachata classes or do other types of tours. There are several roles and responsibilities at the clinic. Of course, we have our doctors, nurses, medical students, but also we have facility managers and administrators, and people that create content for us, such as photographers, videographers, or content creators for our social media. Daily routine at the clinics. Normally, our mornings start from 6 or 7 a.m. People go jogging, talk to their parents, families, and do some personal things. Also, some people prefer to take showers in the mornings. We have warm shower in Guatemalan clinic, and in Nicaragua it's so hot, so you kind of want a cooling shower. At around that time, we also have breakfast that normally includes tortillas, eggs, some porridge, some local fruits, so you will feel very content with the local food. Workday starts at 8 a.m. Doctors and nurses seeing patients, administrators take care of the clinic, and facility manager helps that electricity runs, water is clean, and that clinic is functioning very nice. Lunch starts at around 1 p.m. For an hour, it's enough time to eat and also to relax a little bit before the second part of the day starts. Pharmacy, patients, some labs, some ultrasounds. We have a lot of things to do for medical and non-medical volunteers. Workday finished at around 4 p.m. After that, volunteers have time for themselves. We have Wi-Fi at the clinic, so you can chat with your family, watch a movie, or if you want to enjoy local life, you can go have dinner with some local friends that you will surely make, play with kids, go jog, go do yoga. Basically, that's all up to you. Dinner starts at around 7 or 8 p.m. and after that you have a lot of time to relax. And from 10 to 6 a.m. we have quiet times at the clinic. Please respect other volunteers and don't play loud music or talk when everybody is sleeping. Clinics are operating as only one emergency health facility in the villages, so we are often called for emergency, even if it's after work hours or even at night. Please be kind, be patient, because people need medical assistance even at night. We try to make sure that our volunteers are healthy and safe at the clinics. But accidents happen, so please buy an insurance for your traveling that covers injuries and traumas that can happen with you abroad. At the clinic, we provide basic medical assistance, but some major accidents will be handled by hospitals.
We also ask you to check your vaccination schedule that should be followed when you come to Latin America.
It can include hepatitis A and B, typhoid fever, rabies, dengue, yellow fever, and other diseases that you better take vaccination for. Most important that you know why exactly you want to volunteer at Health and Help. Volunteering takes a lot of time and energy. It's very rewarding, but you need to know why you are doing this. Make clear you know the answer for this question. If you're ready to become a volunteer at Health and Help, next step will be an interview. An interview, we have cases that you will need to solve in real time. Medical volunteer has medical related cases, administrator and other positions have administrative cases. We will see how well you are working under the stress, are you a team member, and how complicated for you is to solve critical situations. Interview takes about 30 minutes, and you also will have time to ask questions that bothering you. As soon as we approve your candidacy, you will receive an invitation via email. Since this moment, you will start your preparation period. Please contact your personal coordinator to see what are the next steps. We are very happy to have you in the team. Thank you for watching this video and good luck!